Hey everyone, it's Dr. Steve Orma, and today I want to talk about what exactly is insomnia. Like, what is insomnia versus what isn't it? Because there's a lot of different ways that people use that term or that concept of insomnia, and they use it in a very kind of general way and kind of give it their own definition. And I wanted to take today to kind of define more clearly about what insomnia is as like a clinical problem, as a problem that needs to be treated, versus the kind of more colloquial use of the term insomnia, which has all different kinds of definitions depending on who's saying it and what do they mean. So what I don't mean by insomnia is just you've had a few poor nights of sleep. So a few poor nights of sleep is poor sleep, right? You didn't have optimal sleep. That could be caused by many different things, but that in and of itself is not insomnia, not like a clinical diagnosable insomnia. That is a disorder. That's a problem. Everybody on earth from one time or another will have poor sleep or a period of poor sleep. That's a universal thing because a lot of different things can disturb sleep, like travel, like sickness, like you have a medical condition, you're sleeping and they're doing loud work on the street. A lot of different things can disturb our sleep, but that is not insomnia. So what insomnia actually is, as a disorder, as a when it becomes like a serious problem, is a pattern of poor sleep that goes over a certain period of time and has certain characteristics. So what are those characteristics? The main things are it's difficulty falling asleep, or difficulty staying asleep, or waking up early in the morning. Okay, so let's define these first. Okay, difficulty falling asleep or initiating sleep. This is called onset insomnia. And, like, what is difficulty? How much time is difficult? Well, they don't really know yet in terms scientifically what exactly is the exact amount of time that's, healthy to fall asleep versus like where it's insomnia, where it's a problem. But generally 30 minutes, if it takes you 30 minutes or more to fall asleep, that would be considered onset insomnia. If you're able to fall asleep within 30 minutes, really ideally within like 15 minutes, that would be considered a normal amount of time to fall asleep. Okay, so that's difficulty falling asleep at least 30 minutes or more, or difficult maintaining sleep. So that's either initiating sleep at the beginning of the night, it takes 30 minutes or longer, or let's say you wake up in the middle of the night and it takes you 30 minutes or longer to fall back asleep. That would also be considered insomnia. And then the third would be early awakening or early morning awakening, which is kind of a form of maintenance insomnia, but it's like you're waking up 30 minutes or more before your general wake up time. So let's say you're getting up at 6 a.m. for work, you have your alarm set, and you keep waking up at 5:30, or you keep waking up at 5 or earlier, and you don't get back to sleep. That would be early morning awakening. Okay, so insomnia is a difficulty in one or all three of those: falling asleep, staying asleep, or both. 30 minutes or longer. Okay, now the second piece is that generally needs to be going on 3 nights a week or more, right? So if it happens 1 night a week, it isn't considered like a diagnosable clinical insomnia. It still may be annoying. It still may be causing problems for you. You still may hate it. But that wouldn't be considered like a diagnosis of insomnia. It's three times or more per week for it to be considered insomnia. So what if you're having it 2 times and not 3 times? Again, like we're dealing with like a person, a human body, and we'll get to sort of when this is a problem at the end, but that's sort of the diagnosis, and the time frame is 3 or more times. Okay, so far we have difficulty falling asleep or staying asleep, 30 minutes or longer, And that's just happening 3 times a week or more. Okay, and the other thing is this has been going on for a certain period of time. This is what I meant at the beginning when I said there's a pattern, right? If that just happens over 1 week, it's not really insomnia, because normally when that happens, your sleep will just come back and you'll pass, through that period of poor sleep. But if it's going on for several weeks into months and certainly years, then this is insomnia, okay? Now, generally, this is separated into 2 kinds. There's acute insomnia, and then there's what's called chronic insomnia. And again, the definitions of these vary because, like, when does it go from acute to chronic? The general time frame is 3 months. So if you've had a pattern of insomnia, as I described, for less than 3 months, it's considered acute. If it's 3 months or longer, it's considered chronic. I would consider, once the pattern has set in, to generally be chronic, but that kind of gives you an idea of how to at least sort of, put terminology to kind of what you're experiencing in a more sort of specific way. Okay. The last thing that's usually included in a diagnosis of insomnia is it's causing problems in your life during the day. So it's not just the trouble like sleeping at night, but during the day you're experiencing impact from it, negative impact on your life. And this includes things like feeling fatigue or tired. This could be difficulty concentrating or focusing or just cognitive functioning. It's interfering with your ability to do your job. Maybe you're missing days of your job. It's impacting your relationships. You might be avoiding certain things or planning your life around insomnia. So you're avoiding going out with friends because you're afraid that if you go out and you get home too late, it's going to disturb your sleep. So insomnia becomes like this really major focus in your life, and it kind of takes over your life. Okay, so there's some kind of impact, negative impact going on during the day. Also could affect mood, right? So it could increase anxiety or feelings of depression, or it could decrease motivation. Okay, there's some impact going on. So if you're having these if you're having difficulty falling or staying asleep through the night or at the beginning of the night, but you feel fine during the day, generally that wouldn't be considered insomnia unless it's really bothering you. Okay, so that is what insomnia is. Okay, difficulty falling and staying asleep, three or more times a week. This is going over usually a period of at least a few weeks or longer, and then that it's having impact during the day, negative impact on your life. Okay, that's insomnia. Now, when does this become a problem? Well, this is very personal, right? I mean, and there's sort of 2 ways to answer this. When does it become a problem in terms of optimizing your health and your well-being? Well, it becomes a problem when you have those criteria that I just went over, because that is definitely going to impact your health and your well-being if you're not getting, your full cycles of sleep that you need to do all the processes that happen during your sleep for all the different systems in your body, and sleep affects every single system. So on a health level, on a well-being level, on a mental health level, on a cognitive level, if you have insomnia in the way that I described, those things are definitely going to be impacted. Okay, so I would consider it then a problem, because it's if you want to have optimum health functioning over time and in the short term, then you want to solve that problem. Okay. Now, another way to think of this is more subjectively, that is it a problem for you personally? So sometimes people have insomnia in the way that I described, but they're getting by. They're they can get through the day, they can work. People with insomnia can function. You can still get stuff done. The body's very resilient. You can still get through life. You can get through the day. And that may then not be a problem for you. Okay, it might be like you can deal with it, you can live with it. Just like, is it a problem when someone is obese? You know, if you're 200 pounds overweight, like objectively, yes, that's not good for your health. There's all kinds of disease risks. There's all kinds of impact on your life, on your joints, on your mood, on your energy. It's definitely a negative thing, and it's unhealthy to be in that state, right? But there's a huge percentage of the population who are obese and who are overweight, and just learn to live with it. Just kind of accept, I have this problem and I'm going to get through my life anyway, and I'm not going to solve the problem, because at that point it's not a big enough problem for them personally. It's not causing enough pain or problems. And this is true with every problem, no matter how negative, whether it's an alcohol problem, whether it's a smoking problem, whether it's a relationship problem. There's the objective, is this good or bad for you, healthy or unhealthy? And then there's the subjective of, how much is this a problem for me personally? How much is this bothering me personally? And, how much effort am I willing to put in to solve the problem? And that is a question that everybody has to answer for themselves, because one thing is true, that you're not going to be able to overcome any of these problems if you're not in a place where you're sick and tired of it, basically, no matter how much it's impacting your health. Okay, so that's an interesting talk that I'll probably do in another video, in terms of like motivation and what causes people to solve problems versus not solve them, even if they're clearly really unhealthy, negative problems. But in terms of what is insomnia and what isn't insomnia, again, just to summarize what I covered, insomnia is not just a few poor nights of sleep or even a couple weeks of poor sleep. Everybody experiences that. It's normal. And usually after those, week or two or a few nights of poor sleep, without you doing anything, your normal sleep will come back. Insomnia, clinical insomnia as a disorder, is what I described. Trouble falling or staying asleep 3 or more times a week over a few weeks, where this is becoming a regular pattern in your life. And it's generally having impact in your life during the day in one or more, many ways, could be very significant impact. And is it bothering you or not personally? That is more of a decision that you have to make. It's more of a subjective choice in terms of how much is this bothering you. If it is bothering you, then you should seek out help. But if not, even if it is a problem, then you probably won't seek out help until it becomes that. Okay? So I hope that clears it up for you. If you're wondering, do I have insomnia? Do I not have insomnia? What do people even mean when you say this? But that is really like a good way to think about the concept of insomnia, from being used as sort of a general, sort of everyday, in the regular jargon that people use casually, versus kind of a clinical definition of insomnia. Okay, so if you like the video, just click like below. And also, if you have any questions about the video today, or you have any questions at all about insomnia that you want me to answer on a future video, then just post below, leave your question there, and I will be sure to to do another video to answer that question. All right. So other than that, have a good day, and I'll see you next time.